just wanted to check in and see how you're doing and how you're feeling this last week. How many days were you having to take the ibuprofen and the pain medication?
So, I mean, I still have quite a few pills left.
Okay.
I took it for the first few days, but that hydrocodone is pretty powerful.
Yeah, strong stuff.
Yeah, it's strong stuff. So I think it made me feel a little bit too jittery. I had to stop taking it.
Okay.
But the pain has subsided pretty substantially.
Okay.
I don't, especially at least like wherever the palate expander is.
Yep.
Apparently, I had a lip tie, which I didn't know.
Okay.
I didn't know it was. I have it also here.
Right on the bottom.
On the bottom.
Yep.
But I had it at the top.
Yep.
I didn't know that it was something that should be removed.
Okay.
I didn't know. I mean, he mentioned that. I guess it could cause like some sort of like recession or something like that.
Yeah, if it's really tight up against the gums that's supporting the teeth, right? That constant pull can cause the gums to recede a bit. But probably just by him doing the surgery up under your upper lip, it released, right? Did he? So yeah, so he just cut it.
He told me
time of surgery.
He told me that he removed it for research.
Okay, nice. You got a free lip tie, lip release done.
I guess, yeah. I mean, I didn't even know that it was, but that's the last thing that is kind of like, because it's sort of swelled up
right there,
swollen right there.
Yeah.
So
yeah, it does look a little puffy, and that I promise you will get better over the next couple of weeks. Sometimes it might be a little bit more challenging for you to smile as well, or kind of move your upper lip. Yeah, because you do have some sutures right underneath your upper lip right there. Yeah, but just give it some time, especially as you're expanding and widening out. It's gonna get a lot better.
Perfect. Yeah.
Good. So like walk me through overall, like, has it been a transition getting used to the appliance and adjusting to it? How's that been?
Yeah, so I think like in terms of the diet, so I've only been eating soft, cold or lukewarm stuff.
Okay.
So with like yogurt, smashed sweet potato, eggs.
Yeah.
I tried eating salmon the other day to see, but like food gets stuck.
Yep.
I guess in between the
little crevices.
The crevices.
The expander. Mm-hmm.
So I've been, I mean, I haven't used the, like, you guys gave me kind of like that,
squeeze bottle?
Like a squeeze bottle that resembles like a water pick.
Yeah.
I haven't used that yet. I've only swished water with salt in my mouth to kind of clean it out.
Okay.
But the Dr. Coppelson said today that I can use toothbrush to start brushing my teeth.
Oh, good. Okay. Talking as well has been okay. Have you been able to adjust to having the appliance in when you're talking?
Yeah, I mean, this is like it sounds like
good. Yeah, I don't notice any major differences when you're talking. I know it feels bulky. You can probably feel it in your mouth, but
I do. Yeah, I do. I mean, sometimes when the food gets stuck, then I have to like kind of like suck it to. Yeah, kind of get it out, but
yeah.
But otherwise, yeah. I mean, it's going to take some getting used to.
Yeah. So just to give you a overarching broad overview of like where you are with regard to the rest of the treatment, and then we'll just kind of nail down like what we're going to be doing for you today, okay? Or what you're going to be doing today. Okay. So basically, we're at the starting line where we're going to be starting the expansion along with the alignment. So we're coordinating that expansion using the clear aligners. And so you're going to be turning and activating the expander, and then switching through the aligners at a kind of regular frequency, right? So that first part is going to be roughly around 4 to 5 months or so, just depending on how much we're expanding. Okay. After that expansion is done, we'll then remove the part of the expander that's sitting on the back teeth. You can kind of feel that.
Like the arms?
Right? Yeah, the arms. And that's what, when you bite down, that's what you're biting down on. Yeah. You can't floss back there as well because you have the bands around the back teeth. So we'll take those out when we're done with the expansion. And then we're going to leave in the top portion of the expander for about another 5 to 6 months until the bone is fully healed. And so by the time we take it out, you're, the palate is now essentially, fully healed, and you'll have the bone be stable. Yeah. Okay. So to get into the nitty gritty details, right? Dr. Coppelson created essentially the suture, or created the split, closed it back up during the time of surgery. So
And over in the back, right?
Also, yeah, so the 2 areas in the back. So he released, they're called pterygoids, right? So that's where the maxilla and the pterygoid connect, right at the back of where those kind of like second molar position are.
Yeah, I have like these 2 very deep holes over there.
You can feel it.
I can feel. Is that gonna?
It will heal too.
It will heal too. Like it'll fill up.
It will absolutely fill up. Mm-hmm. Okay. Yeah, and you won't. By the time you finish the expansion, or even probably in a month or so, like you won't feel any residual grooves or bumps or anything like that.
Really? Okay, that's good to know. Okay.
Yeah. Okay, so now that we're starting the expansion process, which you're going to be starting next week, okay, Dr. Coplin showed you how to do the turns.
Yeah.
Do you understand the concept of like turning the barrel part from the flat side to the corner or to the edge? Do you want me to go over that with you one more time?
Yeah, I might. I mean, because he showed me how I'd be inserting the wrench.
The wrench.
And I guess like I have to do it like this, like from bottom to up, or no, sorry, from bottom
top to down,
from top to down,
top to bottom
for expansion.
Mm-hmm.
So that's what he showed me, but he didn't really talk. I mean, he didn't really talk to me about the exact turn
amount of how much. Okay.
Yeah.
So everyone has a slightly different amount they can open their mouth, and so everyone's going to be a little bit different in how much they can turn the actual barrel, right?
Yeah.
So I want to be consistent as possible in making sure that when I call a turn for you, it's going to be the same as the turn for everyone else, right? Yeah. So rather than just talking about having the wrench go from top tooth to the bottom tooth, I want to specifically look at how much of the actual screw itself is turning as you do the expansion.
Mm-hmm.
Okay. So this is it's called a hexagonal, or it's a 6-sided barrel.
Yeah.
Okay. There's 6 flat faces to that barrel. And then there's also, in between each of the flat sides, there's a corner or an edge between the flat sides.
Yeah.
Does that make sense? Yeah. So there's going to be 6 flat sides, and in between the flat sides, there's going to be 6 corners or edges. When you do a turn, okay, a turn is going to be going from, like, if you were to look at the expander, right, you open your mouth, you look at it. Let's say you see the flat portion of the expander. After you do a turn, you're going to see a corner or an edge between the 2 flat surfaces.
Got it.
Okay. You do a second turn, then you're going to go back to seeing the flat edge or flat surface again.
Got it. Okay. So 2 turns is essentially from one flat surface to the next flat surface.
Exactly.
1 turn is flat surface to the corner.
Exactly.
Okay.
Okay, good. If you start already on a corner, right, then if I ask you to do 2 turns, that would take you to the next flat, or to the next corner, to the next edge, right?
Got it. Okay.
Okay, good. So that's clear. I know visually you're like, you're trying to visualize it. Let me actually bring the model. I can show you what that looks like. And then did you bring your key as well?
Yes, I did.
Amazing. Okay. All right. So your key, I don't know if it has a bend in it, but essentially this key, just for visualization purposes.
Actually, let me just bring this second, Jim, so I can have this also.
Watch your head. Yep.
Okay.
Perfect. So let me know when you're ready.
Yes.
Okay. So right now, do you see this flat edge or flat edge with the arrow right there?
Yeah.
And the arrow is pointing downwards, right? Or pointing down back to the throat.
Mm-hmm.
So the arrow always represents the direction that you need to turn that key to activate and expand the screw. Okay, so you always need to turn it like this way, right? From front to back. Okay?
Yeah.
When I do a turn, right now, this flat edge, right?
So one turn is
going to go to the corner or to the, between the 2 flat edges.
Got it.
When I do the next turn, then we're going to get into the next flat side, flat surface. Okay?
Okay.
Now the question is, how much, how is that represented in your own mouth?
I'll do I like looking at, like, do I see in the mirror? So if I do like,
yeah, go ahead. Okay. So look in the mirror and tell me what you see. Do you see a flat or a corner or an edge?
I see a flat with 2 dots.
Perfect. That's what I see too. So
in this case, a full turn would be seeing the corner after.
100%. Yeah. So when you do a turn, so let's do 1 turn together just to try it out. We're going to do 1 turn together.
Concerns. What? So I'll just use the wrench.
Beautiful. You want me to hold this for you? You got it?
Yeah.
Okay, go ahead.
Okay, so top to bottom.
Yep.
All right.
Beautiful. What I really liked what you did there, Ben, is that, and you just turned it back just now?
Mm-hmm.
Perfect. What I like what you did just there was that you tried to insert it, right? And then it didn't lock in, and so you flipped it 180 degrees. You flipped it upside down and then tried to lock it in.
Yeah.
Because that's what you're going to have to do. Sometimes it might engage the barrel this way in order to turn it, or you might have to do it this way. So you might have to just alternate it, right? You find which way, because ultimately when you engage it, you don't want to engage it where it's like halfway down in your mouth, because you're not really going to get a full turn. You want to get it as close to your upper front tooth as possible so that you can really, get a good bite to it and get a good amount of expansion.
Got it.
Okay. And usually when you go from top to bottom, that's usually, again, about the amount where you go from the flat to the corner, or the corner to the flat.
So it should be enough just for like the turn. I do feel a little pressure, so I'm going to turn up a little bit.
Okay. Perfect. Yep.
Okay.
Good. Okay. So now let's talk about the turning protocol, okay, of how many turns you're going to be doing. Because you've already gotten your split, okay, we're not having to wait for you to actually, create a split, but we need to open up the upper teeth enough so that the tray itself is going to be able to hold on, essentially guide and coordinate the teeth during the expansion. Let me explain. I said that really in a confusing way. Okay. So the first two trays 1 and 2, okay. Do you have those with you today? Trays 1 and 2?
Should I bring them out?
Yeah. You can grab them for you.
Yeah, I brought all the trays.
Beautiful. Good. Trays 1 and 2. So trays 1, is that in the silver case?
Yeah. I think Sharon put it in the silver case.
Have you been wearing your trays this last week, or how have you been doing with those?
No, I've not. I've not been wearing it.
Okay. That's all right.
We were able to find it? Should be it should be this one.
Oh, it's in that one. Okay.
This is like the main one.
Beautiful.
But she told me there was like 2 copies of the trays. I don't know. But
Okay, good. I was just making sure that number 2 was also cut in half.
Yeah.
Do you remember how we talked about the first 2 trays are cut in half?
Yeah.
Right. So both trays 1 and 2. On that top tray, right? The top tray is cut in half down the middle.
Yeah.
So you have a right segment and you have a left segment.
Exactly. Yeah.
The reason why we have it cut in half is because we need to be able to visualize the space that's going to open between your 2 front teeth. Okay. So what that means is that I'm going to have you turn the expander, okay, with the key. And every day, starting next Friday, when Dr. Coppelson told you that it's fine to start turning, you're going to do 2 of those turns every day, right? So if you see that flat side, you're going to do 1 turn, you're going to see the corner, do a second turn to see the next flat side, okay?
Okay.
You can space it out and do 1 turn in the morning, 1 at night, or you can just get them both done at night. Up to you.
Okay.
Okay? Okay. So you're going to be doing 2 turns until you get a slight gap in between your front teeth. Roughly, we're looking for about a 0.3 to 0.4 millimeter space. Okay, that's about the width of about half a dime, okay, more or less. So you're going to visually see a slight space. And so just really look closely as you're turning it day by day when that space opens up. As soon as it gets big enough, we're going to move to tray number 3, okay? And tray number 3 is actually going to be together, so you're not having it's not going to be split.
It's not going to be cut in.
It's not going to be cut in half.
Okay.
Exactly. Yeah. So as soon as you get to tray number 3, you're not doing the 2 turns anymore. Okay.
Okay.
Sorry, let me just turn the shot. So starting tray number 3, you're not going to be doing the 2 turns anymore, and then you're going to be slowing down the turns, okay, and doing the turns in alignment with where you are in the tray. Okay. So for example, let's say you start turning next Friday, okay? And it takes 4 days for you to do the 2 turns per day until you get the slight space. So you turn on Friday, you turn Saturday, you turn Sunday, you turn Monday, And then maybe by Tuesday, you might get that slight space in between your front teeth.
Mm-hmm.
On Tuesday, you're going to switch to tray number 3, which is together, right, to hold that space in. Okay.
So I'm switching both the bottom and the top.
Both the bottom and the top.
Okay.
Okay. And then you're going to be on a new turning protocol where you're going to be turning on the 2nd and the 4th day of that tray, of that aligner. Okay. Each aligner, each tray, you're going to be wearing it for 5 days. Okay. So let's say, for example, day 1 of wearing tray number 3 was like Wednesday. Okay. Day 2 of that tray is Thursday. You're going to be doing a turn that day. Day 3, you're not going to be doing any turns, just using the tray itself, using the aligner tray.
Okay.
Day 4, you're going to be doing a turn. Day 5, you're not going to be doing any turn.
Day 6, we're changing the tray.
Day 6, we're changing the tray, which is also day 1 of that tray. So you're just going to rinse and repeat. So day 1 of that tray, you're not doing a turn. Day 2, you're doing the turn. Day 4, you're doing the turn, right?
Got it. And the turn is from flat to corner? Or
you're just doing 1 turn on the 2nd and the 4th.
Okay. So that makes sense. So what, because it's just to make sure I understand.
Yeah.
First step is, well, first of all, when do I replace from tray 1 to 2?
You don't ever have to use number 2 unless you either lose or break number 1. You might just skip all the way entirely because, again, 1 and 2 are the exact same thing.
Oh, okay.
So they're essentially just backups of each other in case you need it.
Okay.
Most people don't go to number 2. They just go from 1 to 3.
Okay, got it. So the second I start seeing the split, change to number 3. First day, nothing. Second day, turn. Third day, nothing. Fourth day, turn.
Yep.
Fifth day, nothing. And then
day 6,
I move to a new tray.
Correct.
And then the cycle repeats.
Yep. Yeah. And all this is also written down, I think, in the handout that we gave you as well.
Mm-hmm.
The only thing I would adjust to that is before you move to tray number 3, take a quick selfie of your smile so that I can visualize how big that space is.
Okay.
And I'll give you the go ahead of, hey, you're ready to switch to tray 3. Or I might say, hey, let's turn for 1 more day just to make that space a little bit bigger.
Mm-hmm.
But I'll give you that guidance as soon as we see that picture.
You got it.
Okay. So as soon as you notice any slight picture or any slight space, take a picture and send it to us. And then we'll let you know, hey, turn for 1 more day, or yeah, you're ready to move to tray number 3.
Got it. Okay. So that was, once again, so for the first step before we move to tray number 3,
yep,
I'm turning it twice a day until I see that
hairline spec. Yep. Yep.
Okay.
Yeah, twice a day. To keep it simple, you can do it both right before we go to bed.
Mm-hmm.
Most people do it like right before they go to bed. Some people are like, oh, the pressure or whatever bothers them, and so they just want to do it right before they sleep. Or if you want to space it out a little bit and just do 1 in the morning, 1 at night, you can do that as well.
Okay. So yeah, I guess I'll start. I mean, he mentioned to start on Thursday. I'll just start on Thursday. So 1 turn in the morning, another turn at night. I'll just keep doing it. Send you a picture, and then we move.
Beautiful.
And then
we'll hit the ground running. Yep.
And so, this in terms of the timeline, because I want to make sure I understand.
Yep.
So we're gonna be moving like from tray 3 to tray 4 every 5 days essentially as I expand.
Yep.
How long is that? Like, how long is the whole expansion gonna happen before we stop cranking essentially? Oh, actually, that hasn't been determined yet.
Yeah. So again, on average, the expansion is between 4 and 5 months, depending on how much expansion obviously you can handle, your mouth can handle. We have a preset number I think we talked about, but let me double check and see what the upper limit is.
Mm-hmm.
And whether you choose to stop expansion before then, if you're like, hey, I'm really happy where I'm at, right? I'm like 3/4 of the way through. I'm breathing way better. I feel like perhaps I'm not breathing, additionally better with every turn. I like where my smile's at. I don't want to get wider. You don't have to, go to the very end, but you have that as an option if you'd like to. But yeah, essentially, I'll tell you kind of the upper limit of what's possible, and then you make that determination of where along that path you want to stop.
Got it. I mean, I guess because the constraint or the limiting constraint is really my lower jaw essentially, because I want to make sure that the upper jaw has the appropriate width to match the lower jaw.
Yep.
And so
exactly.
I guess we can probably go by that. But then also, obviously, we're also sort of expanding Well, I don't know if we're we're doing
The aligners on the bottom. Yeah. So yes to both those points, in that the limit of how much we can expand the top jaw is where ultimately the teeth and the bite will line up, because we can't make the upper jaw so wide that they're going to cross over and not hit and occlude with the lower teeth.
Yeah.
Then we're creating a problem that we don't need to, right? So our limiting factor is how much the upper jaw itself should expand. And then ultimately, yes, after the expansion is done, we are going to be able to modify the tooth position, because typically when the upper jaw is narrow, the upper teeth are slightly tipped outward. So after we expand it, we overexpand just a little bit so that we can bring the upper molars kind of back in line with where they're supposed to be.
Okay.
Right. But also at this point, we're also bringing the lower teeth slightly out as well to make sure that we're getting the full expansion of the upper jaw that we need to.
Got it. Okay. So after 4 to 5 months, they were roughly around that time, that we're done essentially with the expansion. We're not done with the alignment.
Correct. Yeah. So we're going to have another roughly 8 to 12 months, something there around there, where we're still working on the alignment and the occlusion and the bite.
Got it.
Okay. Because the bite is going to get a little worse before we bring it back together again. Right. During the expansion, things will, ultimately kind of things will get undone from where your bite has settled and stabilized in this position, because we're creating a new kind of equilibrium point. We're creating a new set position for things to settle in.
Got it. And during around that time, am I also going to be wearing, like, I guess, the rubber bands, like, around, because I'm assuming the wings next to the arms are for...
Yeah, exactly. So about 5-6 weeks from now, we're going to be giving you some aligner trays that have little buttons on the inside of the lower teeth. And then you're going to be using those rubber bands that attach from the outside where the band is on the top to the inside of those lower teeth to help to bring those lower teeth along for that ride during the expansion.
Got it. And are those rubber bands, are they already, like, in the...
The rubber bands are not there, but that's the next time I'm going to see you. I'll give you some more I'll give you rubber bands, and I'll show you how to do it. It's just so that you're aware.
Got it.
So you're starting on tray 1. Roughly, I'd say, tray 10 or tray 11 is where you're going to have the little hooks on the inside. So say give or take, if you're not starting for until next week, to go from tray 3 to tray 10 will take about 35 days if we add another week on top of that. So in about 6 weeks, I'll see you again.
Okay.
And then we'll check in with you, see how your expansion's going. We'll start with the rubber bands then in 6 weeks.
Got it. Okay. Should I be wearing the tray number 1 right now? Or should I only start wearing it when I do
I would say just get used to wearing it at nighttime, at least, kind of just getting a feel for what it's like to have them in. And then obviously, like, practice taking them out. You've had alignment trays before, actually, but you're pretty good with it. So yeah, you don't absolutely have to wear it until you start with the turns. Trays 1 and 2 are more for comfort, and then tray 3 is when you need to wear it. You need to wear it for the actual movement of the teeth.
Got it. And actually, so if you remember from the previous alignment treatment that I was doing,
yep,
this lower molar was still, like, twisted.
Yeah.
Was that accounted for in the
plan?
In the plan?
Yeah. Any alignment or any kind of big movements as far as during the expansion, we also will align. We also will get those teeth to as close of a position as we can.
Yeah.
They're not going to be ideal. Again, they're not going to be ideally perfect because a lot of things are moving, but it'll be kind of moving along that step. And then whatever we don't get addressed in this first round during the expansion, we'll knock it out during the refinement, during the additional trays.
Okay. That's fine. Okay. But so this is also addressed the
rotation of the tooth. Correct.
Okay.
Yeah.
Perfect.
Yeah. We're not just expanding without correcting any of the rotations. We are going to do that too.
Okay.
Yep. Good stuff.
All right.
So here's your tray. And have you tried it in the last couple of days to see if it fits in? Do you want to just try it in?
Yeah. Maybe we should try it, especially the upper one. I haven't I mean, I was gonna try the upper one, but just because of the healing of the upper lip, I didn't want to mess with it.
Yeah. I don't think it's going to be a problem because, again, they're cut in half. And also the bottom one, you're not going to have a problem with the bottom one either. So I think you should be fine. But
Yeah.
this might as well, let's try it in and see how it fits. Yeah, that sounds good.
Yeah, so that one's fine. And then,
Beautiful. Can you see? They fit great. Yeah.
Yeah.
That's how it's supposed to fit. Yeah, you had that nice satisfying click when you pressed it in there too.
Yeah.
Yeah. Good.
Okay.
Okay.
And then I also asked Dr. Coppelson, but I want to ask you as well, regarding the diet, because this is it's not like a heavy jaw surgery. I mean, am I able to, like, at what point am I able to start eating solids technically? And
that's a good question. I mean, I don't see any contraindication for it. I mean, yes, you've had a minor jaw surgery, but by no means is your jaw unstable, because it still has solid connections in multiple places, other than where it was split.
Yeah.
Yeah, generally when we do these expansion procedures, I'm not restricting or limiting food. Now, given the surgery, there's other reasons why he would do that. So for that reason, I'll let Dr. Coppelson specifically answer that. But for me, it's not necessarily because of the expansion. I think it just has more to do with the surgical release itself, that you may be limiting harder foods. Did he tell you a couple of weeks, or how much more time did he say to lay off?
So he said I could technically start eating solids now.
Okay.
And I wasn't really sure, because initially, I guess maybe I did some additional research or something and said, no, I'm going to have to be on the soft food diet for like 5 to 6 weeks.
No, that's with the previous. So if you looked up specifically like a surgical expansion, right? The previous approaches of how they would do it, they would create additional cuts, disarticulating like the entire upper jaw. And it would be a lot less stable in that upper jaw. And so that's why they wouldn't want you to, eat solid foods. But because we're not doing those same cuts, things are done in a more minimally invasive way. You don't have those same dietary restrictions.
Got it. Okay. So let's say if I want to eat like a piece of meat or something, I'm allowed to bite.
Yeah, absolutely. Yeah. This is one of the big benefits of doing this expansion procedure, is that it's not the same recovery, or by any means, the same limitations and restrictions as like a conventional jaw surgery, or even the previous generation of expansion surgeries that were done before.
Got it. Okay, I guess then that's good. It's amazing.
Good news. Yeah, definitely. Well, hopefully next week you're gonna start to really feel the benefits here. I'm super excited for you, and keep me posted. Yeah,
absolutely. Yeah, I'm very excited for this.
Amazing.
Okay, so
good to see you.
Good to see you as well.
Yeah, for sure.
And we'll meet. What is it in 6 weeks?
6 weeks. I'll check back in with you.